I'm sitting down today with Lindsay LaSalle with the Drug Policy Alliance, and she's come and joined us as part of the Harm Reduction Conference. We're really pleased to have you here.
Thank you.
Pleased to have you be part of this big conference. So tell me about your organization and the work you do on the issues of addiction treatment and drug policy.
Absolutely. So I work for the Drug Policy Alliance, which is a national organization that focuses on advocacy strategies and developing solutions to our current war on drugs. We're really trying to scale back those super harsh punitive penalties and work more towards a health-centered approach. So we're really just trying to move the paradigm away from prohibition, away from criminalization, and toward harm reduction services, prevention, treatment. And we do this through a number of different avenues. We pursue advocacy around marijuana legalization and obviously trying to roll back prohibition and all the harm that has caused. And then we also focus our advocacy on broader criminal justice reforms, sentencing reforms, where we're trying to reduce offenses, for instance, from a felony to a misdemeanor or a misdemeanor to an infraction, and really use those resources that would go into enforcement of those offenses toward other more health-centered paradigms like treatment. And then we also really focus on harm reduction. So we're looking at ways to reduce the harms not only of drug use to the individual and the family and the community, but also what the harms of prohibition have been in terms of lack of employment opportunities because you now have a felony on your record, broken families, lack of access to treatment because all of our dollars are going towards enforcement. And looking at all of those harms and developing solutions around them, which could include, overdose prevention, like Good Samaritan laws and naloxone access, increasing access to medication-assisted treatment, and then looking at some that are kind of considered a little bit more progressive and that we haven't yet reached in the United States, like safe injection rooms or heroin-assisted treatment. So really just trying to move the ball down the court in terms of a health-centered approach to drug policy.
And so in thinking about how to move the ball, moving the ball down the court, not to mix metaphors, what really needs to be done to address the problems of drug addiction and drug-related violence in Maryland, you think?
Well, I think in some ways Maryland represents what's going on in the rest of the country. And I think that is, we have seen that our current policies have failed, and they've failed us badly. Drugs are more widely available, they're cheaper, and they're purer than they've ever been. Treatment admissions have not gone up, but enforcement costs and arrest and incarceration has. And so I think kind of the first step is just recognizing that what we have doesn't work. And that is going to entail some public education. Well, I think that people kind of generally can see the data and the stark numbers. Many times people fall back on their individual experience with drug use. Perhaps they know someone who has experienced it, perhaps a member of their family has experienced it, and it's so traumatic and it's so difficult for the families that it's often hard to step beyond that and say, what are the broader policies that are impinging on my loved one or are impinging on our community, and are they really addressing what I think is the problem? And if they're not, then what are some better solutions? And so that really takes just a little bit of hand-holding, a little bit of coaching and helping people to understand not only the harm that the addiction has wrought, but the harm that these policies have really wrought on our communities as a whole. And then it takes really helping them to see a different path. I think a lot of people are at the point where they realize, yeah, the drug war has failed. It's not working, but they're stuck with how do we move forward? And I think that's where we as the Drug Policy Alliance can kind of help people understand that the next frontier is really looking at innovative harm reduction policies that focus on treatment and that focus on reducing the harms so that they can understand that there is a way to address drug use that doesn't have to be punitive and prohibitive, but that can still create a lasting solution where we manage drug use in a more positive way.
Sure. And so as you think about how drug use is really a physical addiction. It's a disease, and we need to be addressing it in terms of a public health crisis rather than a law enforcement crisis. What sort of work is the Drug Policy Alliance doing in Maryland to really move that ball forward in terms of changing the culture of the conversation?
Well, I think participating in this conference is a good first start. We do have an office in DC that focuses on national policy, but being that it is next door neighbors to Baltimore, is trying always to keep its finger on the pulse of what is happening in this state. What our participation in this conference is hopefully going to do is to allow us to provide technical legal assistance and expertise to the people who are participating in the conference, who really have their fingers on the pulse of what the issues are in Baltimore. And then in my role as a lawyer for the Drug Policy Alliance, I can come in and say, this is the way that we can craft solutions legally to the problems that you're facing. And here are examples that we can use from other states to really help move you in Maryland. So for example, in some ways that, Maryland might lag behind in terms of syringe exchange or less robust Good Samaritan law, we can come in with very specific legislative solutions to really help up that game. And I think that we also just bring a level of nationalized perspective on both the problem and the solutions. So one thing that I've been talking to a number of people about in Maryland, and that I hope people run with either at a local or a state level, is supervised injection facilities, and also the possibility of heroin-assisted treatment, which is the provision of pharmaceutical grade heroin to people who have failed all other forms of treatment. So people who have an opioid use disorder, who have tried methadone, they've tried buprenorphine for 20 years and they've failed. We have an example from 9 other countries of scientifically proven treatment that when you give them pharmaceutical grade heroin, crime goes down, recidivism goes down, retention and treatment goes up, the spread of infectious diseases goes down, Professor Peter Reuter published a paper a while ago now on whether or not Baltimore was ready for heroin-assisted treatment. And I think that we at the Drug Policy Alliance really do believe that now is the time. And so that's something that we're trying to bring to the conversation today, and more broadly, is Baltimore really ready to push some of these more progressive reforms, given the problem that it's faced with heroin and in the opioid crisis at large, including prescription pills. So while we don't have a presence in Maryland, we are certainly trying to work with our allies here to push some really interesting and innovative legislative solutions.
And just as a final lead off on that, as you are thinking about how the small working groups have been coming together around each of the individual issues, what would you see as a best case scenario for what could come out of the harm reduction conference?
Well, I think that a menu of innovative reforms, potential innovative reforms, would be a great option, even if they don't all get pushed in the coming legislative session, because it means that people are thinking about them and people are starting to lay the groundwork and the foundation for what would be required, not only to get a law passed that would authorize some of these more interesting, innovations, including, law enforcement assisted diversion or other pre-booking or pre-trial diversion programs, potential decriminalization, and some of these more innovative harm reduction interventions that I've mentioned. It would mean that, the ball is rolling. People are talking about it. And sometimes it takes a few legislative sessions for something to actually get passed, but we can start the groundwork now in terms of building consensus around these issues. The other thing that I'm personally taking from it, which I kind of see as a success, is that because I do a lot of work in other states, and we have this amazing opportunity to have such a unique group of people where we have academics and researchers and physicians and harm reductionists and lawyers all in the same room working around a table collaboratively, all bringing really unique perspectives. That that actually isn't an opportunity that I've had before. So personally, I'm taking a lot from it because the ideas that I'm hearing and the knowledge that's being shared, I can take with me and use in my own work in other states, and just building, broader coalitions at large. So I think that there's, a number of kind of successful endpoints that can result from it, but I'm glad that at the very least I get to take a lot of the knowledge that I am learning today back with me and integrate it into my own work.
Fantastic. Lindsay, thank you so much for joining us
thank
today.
you.